Okay, let's talk a little bit about sick animals as it relates to body water and rumen function and blood and those sorts of things and those maladies. So we're going to talk about a cow that goes down and then flops over. What are the challenges there? What about something that calf that gets dehydrated? We'll talk about acidosis and displaced abomasums, DAs. And hypertonic saline IV and what that does, at least to start. We'll probably finish that up when we get to kidneys. So with our down cows, we have a cow that goes down, no longer can stand up, support herself, and then eventually she's going to go over. As she goes over, she's probably not going to be eating, probably not going to be drinking. She's going to be dehydrated. She's probably going to be hypoglycemic. And as she goes over, as she lays on her side, that lateral recumbency, not the sternal, on the sternum, sternal recumbency, lateral, she's on the side. Rumen function and orientation are messed up, so rumen never doesn't function well. We need to reestablish that to get her back to where she needs to be. So we're going to prop her up to get the rumen orientation and therefore function back to where it needs to be. Provide her with water, provide her with feed to get her back to dehydrating, get her back to a carbohydrate metabolism that's going to keep her functioning. We also have to get her off those legs or she's going to have some trouble getting back up, nerve damage and stuff like that. So if we've got a cow that goes down, it's very important that we get the rumen oriented where it is. So usually we'll bring in hay bales, skid steer, something that kind of forces her to be propped up in that sternal recumbency, get the rumen vertical. So if you're doing a skid steer, if you back that up on a bale, something soft, it usually works pretty well. Or if you got really big bales, you put those up against there. At least when she's leaning and then she has access to food and water, she should be able to have proper rumen function, and that's more than anything what we need for healthy animals. We need proper rumen function to get those animals up and going again. If we don't have proper rumen function, we need to think about something. Um, our B vitamins. A normal healthy rumen will produce all the B vitamins she needs. The rumen's not working the way it should. Maybe there's an opportunity for us to derive some benefits by injecting or by dosing the animal with some B vitamins. Diarrhea. So, diarrhea in calves, we have two basic causes of diarrhea. One is we're not getting absorption. So, we're looking at the damage to the epithelial lining of the intestines. So, we lose surface area, we lose absorption, function of those, and that prevents the water from being absorbed, and the water flows through the calf and never gets absorbed. The other is that we have some sort of water transport into the lumen of the intestine, the interior of the gut. And this is due to usually something osmotic. We have a solute in the lumen. The solute concentration is higher in the lumen than it is in the blood. So water goes down its concentration gradient and gets drawn into the lumen. Water follows solute. So when we have diarrhea, we're going to get dehydration. Dehydration is what we need to fix, what we need to prevent moving forward. And dehydration is water going out is greater than water going in. So maybe for the two reasons previously stated, but those water pools in a calf, the blood is going to be defended at the expense of the others. So we need the blood volume to remain constant so she can circulate the nutrients around, get the oxygen around. So that means she's going to pull from the interstitial, she's going to pull from the transcellular, she's going to pull from the intracellular. And that's where she's going to lose water. And as those pools get reduced, she not only loses water, but she loses electrolytes as well. So as the water pools are reduced, we lose water and the accompanying electrolytes there. Because remember, all the tissues are isotonic. So if we lose water from one of the pools, we're going to lose the corresponding electrolytes at the same time. So we need to feed the calf to replace the water and the electrolytes. So if we can keep milk down, we need to continue to feed those, and then we supplement on top water and electrolytes. So we don't want to have feed them at the same time, add water to the milk, add electrolytes to the milk, because the milk won't be properly digested. It can't form the clot in the abomasum. So we want to feed them separately. If I was going to do it at the same time, I do the water, then come back a few minutes later and do the milk. Allow the water to pass into the body, allow it to go down the track, um, hopefully get beyond the abomasum before we feed that milk that has to go into the abomasum and clot, form that protein clot that gets slowly digested in the small intestine. So we need to figure out a way to provide an electrolyte solution, electrolytes and water, to these calves. So here's one product. If you look at the contents of that product, I'll try to get the full labels up on Blackboard, but you got sodium chloride, electrolyte, phosphate, potassium phosphate, another electrolyte. You got a citric acid that may act as an energy source. It's also got a charge to it, potassium citrate. You've got electrolyte, possible carbohydrate source, and then some additional amino acid here to get things rolling. The vast majority is electrolytes, so you're putting that in solution and you're doing some energy as well. The product, we're trying to get lactose in there. So lactose provides energy to the animal. Hopefully it won't upset her digestive tract, that she's got enough lactase, the thing that'll split lactose apart so it can be absorbed. We got sodium, salt, potassium, um, providing the electrolytes. So lactose, glycine, salt, sodium bicarb, potassium chloride, citric acid. In this case, citric acid is probably a preservative in some way, shape, or form. So we look down here, stressed or scouring calves for each calf 2 times a day. Dissolve 1 pack into half gallon of water. No milk or milk replacer should be fed during the treatment. Feed as a substitute or milk or powered milk replacer. The idea is that you're getting electrolytes, energy, and water with this feeding. Again, you don't want to feed it at the same time as milk or milk replacer because that's going to mess up the digestion of the milk and you may actually exacerbate the diarrhea by that milk not being digested properly. So what happens if you don't have a commercial product available? Um, there are a number of different recipes out there. Gatorade. This is what is it? A homemade Gatorade. Maybe not the best balance of things, but they do have electrolytes. They do have carbohydrates. We'll try to get things posted on Blackboard. Here's a number of different uh, recipes that provide electrolytes, provide nutrition, and provide the water that gets the animal rehydrated. So water, electrolytes, and then if we can, some energy and light protein helps Like this beef consomme would be a light protein, helps get the animal back on its feet. We don't want to starve the animal. We'd like to try to get milk into the animal as well as the electrolyte solutions. Because remember, the animal's dehydrated. We have to feed her more, give her more to get her caught back up to where she needs to be. So, electrolytes is an article from Penn State. We'll try to get that posted for you at um, Blackboard. Acidosis. So we're thinking about acidosis. We're talking about too much VFA produced in the rumen. We either can have acute, where we have a whole lot produced very, very quickly, and that can kill a cow pretty quick, or we have more of a chronic situation when we think about the beef feedlots. We can deal with kind of chronic acidosis, a little bit too high, but not excessively or life-threateningly high. We can have clinical, where we see the animal exhibiting signs of acidosis, or more often what we have in dairy cattle is a subclinical. We have some drop in pH in the rumen, some excessive VFA in the rumen, but you don't really see any outward signs other than the cow's a little off feed for a couple hours. So this is what we usually find in our high producing dairy cows. Take advanced nutrition, we'll spend more time on it. But we're thinking about acidosis. We're looking at excess VFA in the rumen. This leads to increased osmolality, increased solute in the ruminal solution. Water is now higher on the outside of the rumen than the inside of the rumen. Again, we're talking about a situation where things are messed up. The osmolality goes up and it's greater in the rumen than in the blood. Water starts to push into the rumen. If the difference in osmolality, the increase in osmolality is great enough, you're going to have damaged lining and possibly dehydrating the animal by drawing all the water into the rumen from the blood. That damaged lining is going to have holes that are going to leak water and contents. All those contents are going to go to the liver first, and then eventually those scars form over those holes, and that becomes an area that does not absorb again. So, at least as far as we know, there have been studies up to a year where those spots, those tears, those holes, as they heal up, do not absorb again. They're scar tissue, which makes sense. They probably looking at a typical cow, as we said before, we have solute actively removed from the rumen, making this hypotonic. Water wants to go that way, but the rumen blocks the water from doing that to maintain rumen volume and to maintain blood volumes normally. So that's normal flow from the hypotonic to the after a very fermentable field, that meal, that hypertonic solution, we might get a 350 in the rumen versus the 300 isotonic. The desire of the water is to go in. We know we have a barrier going out. We don't have a barrier stopping it from going the other way because this is not a normal solution. It's sort of like the redneck hot tub, a redneck. You line the pickup with a plastic liner, and you have it set up in the back of a pickup. So you have the strong outer wall of the pickup prevents the water from leaving. So that's the way normally things are. But that liner, depending on how thick it is, you could easily get your hand behind it and poke it out. It's meant to stop going water out, but it's not meant to resist forces going in. If we think about the body water in our lactating cows, you have 13% of the body water is in the rumen, 8% is in the plasma. If we have major shifts of stuff moving back and forth between the two, we can really get the cow into trouble. So if we think about if water moves freely um, across the lining, so you have a 1,300-pound cow that needs 106 pounds of water in the reticular rumen, 68 pounds of water in the plasma. If the ruminal solution is acidotic at 350, we'd have, in order to bring that back to isotonic or 300, we'd have to move 24 pounds of water into the ruminal solution. So to drop that from 350 to 300 takes 24 pounds, 3 gallons of water. If we take 24 pounds out of the plasma and put it into the rumen, you're going to drop blood volume by a third, and your animal's probably going to pass out. So this is where we get the severe acidosis, we get dehydration. The water goes down its concentration gradient and goes into the rumen, and we add 24 pounds of water to the rumen, and we dehydrate the cow by pulling out 24 from the plasma. These large swings in water pools are not a good thing. So acidosis leads to that, and that's a bad thing. So the effects of acidosis on the cow, we've got increased VFA, increased osmolality, a hypertonic situation, water goes the wrong way. There's no barrier to it going the wrong way. So the water moving across that epithelium the wrong way is going to generate blisters, which will eventually tear, which will eventually create holes in the side of the rumen. Water, once we have holes established, water moves both way, and contents are going to leave the rumen. So we got feed, bacteria, protozoa, etc., leaving the rumen going into the bloodstream. The contents that we have collect in the GI capillaries. So you have the capillary bed surrounding the rumen. All that stuff feeds down to the portal vein. Portal vein then fills a capillary bed that goes throughout the liver. The liver is meant to filter and detoxify. When it gets a load of feed and bacteria, you're going to get an inflammatory response. The liver is trying to defend itself against these infections. These infections agents, you're going to get histamines produced. And we talked about that in the immune response. Those histamines are going to have localized swelling wherever they go. We're going to have bacteria and feed particles stuck in the capillary beds of the liver. These are going to lead to liver abscesses, which is not a good thing. You've got a compromised liver now. That inflammatory response starts at the liver. That's going to work its way across the body. You've got laminitis. You've got clots in the capillary beds in the feet. These are going to lead to damage to the scorium. Basically, in both cases, the swelling and the clots are going to lead to lack of blood flow in the feet. That lack of blood flow is going to lead to hypoxia, starvation, and we're going to have a damaged corium. A little bit more visually. So you've got the lumen of the rumen. You've got the capillary bed that surrounds that rumen. All of that drains into the portal vein. The portal vein goes and opens up to the capillaries of the liver. That drains to the vena cava. That goes to the heart and lungs, and then to the capillaries of the body. So in the case of the acidosis, we've got water going the wrong way. It's going to go this way. As it does that, it's going to try to get that water into that hypertonic rumen. You've got blisters that are going to start to form. As they get bigger, they're going to start to tear. As they start to tear, they're going to form holes. The hole in the rumen is going to leak out contents. So feed, bacteria, protozoa, fungi are all going to end up in the capillaries. They're going to be funneled to the portal vein, and then they're going to end up in the liver. So you've got bacteria, feed particles, all non-sterile, ending up in the liver. The liver is going to try to filter, it's going to try to detoxify, but it's probably going to be overwhelmed. You're going to get that full inflammatory response, secreting histamines. You've got feed particles and bacteria forming abscesses. That's going to compromise liver function. So things are not going to work as well. We've got those histamines and those little particles. The inflammatory response is going to go around the body, but when it gets down here in the corium, you're going to have a confined space. You've got the hard hoof and then the bone, and then you got this tissue is going to be swelled up, clogged up. As it's swelled up and clogged up in this confined space, you're going to get laminitis. You get that swelling of the lamina, the swelling of the corium. That's going to lead to reduced blood flow, um, less oxygen to the tissue, less nutrients to the tissue, and you're going to get death, and you're going to lose the quality of hoof formation with the laminitis. See the swelling, you can see it a lot of times up at the top of the hoof and then down here. So you're going to get compromised hoof wall. You get the curly toes that are usually associated with that, and you get the corium destroyed. It's no longer going to support the toe in the hoof, and it's no longer going to produce hoof, which is going to be a problem. So we've talked about the first three. We've got DAs and hypertonic saline to go. Displaced abomasum, a DA. So normally these occur right after calving, and I'm going to propose a sequence of events that would happen. Is this a law or fact? No, it's my theory on how things work. We'll see if time tells. So we know at events around calving that tend to predispose the animal to a DA, and one of them is hypocalcemia. We've talked about that before. What that does, it's going to reduce the tone of the smooth muscle in the forestomach, in the stomach. And then acidosis is going to increase the VFA in the rumen. So if we have those two circumstances, she doesn't eat for a while around calving. After she calves, she's real hungry. She eats a lot. She's going to produce a lot of VFAs and have acidosis. So the consequences of hypocalcemia is a lack of tone. That lack of tone is going to make that forestomach, that abomasum, loose and sloppy. So you're not going to be able to hold it in place as well. Acidosis is going to lead to too much VFA. VFA is going to overwhelm the system. You've got a transition period where the rumen, the reticulum, the omasum are not geared up to absorb the electrolytes, absorb the VFAs as fast as they need to. So we're going to get VFAs bypassing the abomasum. They're going to reach bypass the omasum. They're going to reach the abomasum. They're going to act. Those VFAs are going to act as a buffer for the hydrochloric acid that normally is secreted in the abomasum. If they act as a buffer, the pH will not drop, the bacteria will be not killed in the abomasum. If the bacteria are alive, they will continue to ferment, they will continue to produce gas. If they are alive and produce gas in the abomasum wants to float up. If there's no tone, it's sloppy because of hypocalcemia, it will go in that direction. So you're going to lead to a filling with gas and a flip and a twist. So you've got a displaced abomasum, a twisted stomach, and you're going to have to do some sort of intervention, either roll and tack or surgery to get that abomasum back where it needs to be. So you could see that hypocalcemia acidosis, according to this hypothesis, would predispose an animal to a displaced abomasum. Hypertonic saline, we'll talk more about this when we get to the kidneys, but we give an IV of hypertonic saline. I'm going to ask you if you remember which vein we put it in traditionally. We get with that hypertonic saline, we get a local increase in the blood osmolality or sodium. That is sensed by the brain. So we're putting it in that vein. When's it going to get back to the brain? You're going to have to do a full cycle. Once that osmolality, that sodium reaches the brain, there is a very, very, very strong desire to drink. We're talking about gallons immediately. If you've ever given the animal hypertonic saline, you give her a bucket. Within a minute, she's usually got that 5-gallon bucket empty. Really strong drive to eat. So the brain, or drink, that brain sodium osmolality on the brain leads to that very thirsty thing there. So the advantage of the hypertonic saline is the water flows through all the pools and is excreted out the kidney. So it comes into the digestive tract, goes to the omasum, abomasum, large and small intestine, gets absorbed. That flood of water goes through and is eventually removed by the kidneys, out the put in the bladder, and then out. And with that big flood of water going through the cow, there's an opportunity to flush the toxins out of her system. Given the way the kidney works, the more fluid that goes through that kidney will help flush out some of the things that aren't supposed to be in the blood. The kidney will let them go to the bladder and things will get flushed out. So usually a sick animal has no desire to drink. She's dehydrated. The kidneys aren't working or flushing as well. That addition of a hypertonic saline is an opportunity to flush out the junk to get her rehydrated. Um, Instead of standing there with a 5-gallon saline solution, you give her the hypertonic saline and then let her do the drinking to get things balanced out again where they need to be. And again, the water moves through the pools of the body and eventually, we hope, flushes out the bad stuff.